10 warning signs in newborns that parents should never ignore. Newborn babies cannot tell their parents where they are hurting, how uncomfortable they feel, or what health issues their bodies are facing. Some signs like hiccups, sneezing, startling, or spitting up a small amount of milk can be completely normal. However, in this video, we will explore 10 important signs in newborns that parents should not ignore. Please watch until the end of the video, because the final sign is often mistaken for a baby. In the first few months of life, a baby's immune system, respiratory system, and ability to regulate body temperature are not yet fully developed. A health issue can progress much faster in a newborn than in an adult. Therefore, parents should not rely on just one single sign. Observe the baby's overall condition, including their ability to feed, the number of wet diapers. Every baby has different feeding, sleeping, and bathroom habits. When a baby shows a clear change from their usual routine, it may be a signal. A fever in a newborn is always a cause for concern, especially for babies under 3 months old. If your baby's rectal temperature is 38 degrees Celsius, which is 100.4 degrees Fahrenheit, or newborns can have serious infections that initially only show up as a fever, poor feeding, or sleeping more than usual. Parents should not just feel the baby's forehead to guess the temperature. Use a proper digital thermometer and measure according to the instructions of healthcare professionals. Do not give a newborn fever. Using the wrong medicine or the wrong dose can be dangerous. Besides a fever, an unusually low body temperature can also be an abnormal sign. If your baby is unusually cold, sign number 2. Difficulty breathing. A newborn's breathing rhythm can be irregular. Babies sometimes breathe fast for a few seconds and then slow down. However, if a baby is constantly breathing very fast or struggling to breathe, this is no longer normal behavior. Parents should pay attention if the baby's nostrils flare. The baby may also make a soft grunting sound at the end of each breath, wheeze, or make other unusual noises. If the baby's head bobs slightly with every breath, it could also be a sign that they are using too much effort to get air. Parents must seek if their skin turns gray, if they stop breathing, or if they are unresponsive, call 911 right away. Do not try to feed the baby when they are having trouble breathing, as feeding can make them more tired or increase the risk of choking. Sign number 3. Refusing to feed or feeding very weakly. The ability to feed is one of the most important signs reflecting a newborn's health status. When healthy, babies usually have a strong reflex to root, latch. If a baby suddenly does not want to feed, only sucks a few times, and then falls asleep, cannot latch onto the breast, or is significantly weaker than previous feedings, parents need to pay attention. A baby may refuse to feed due to a stuffy nose. If the baby consistently skips multiple feedings, is hard to wake up to feed, or vomits everything right after feeding, contact a doctor. Do not try to force milk into the baby. Sign number 4. Fewer wet diapers or signs of dehydration. The number of wet diapers is a simple way for parents to track if the baby is getting enough milk and staying hydrated. In the first few days after birth, once the milk supply has stabilized, many babies usually have about 6 or more wet diapers in a day. However, this number can vary for each baby. What is important is that parents recognize other signs of dehydration include a dry mouth, few tears when crying, dark yellow urine, or a strong odor. If the baby does not urinate for several hours, vomits continuously, or has diarrhea, parents should take them for a checkup. Sign number 5. Abnormal vomiting. Spitting up a small amount of milk after feeding is quite common in newborns. The milk usually flows gently out of the mouth. The baby remains comfortable, feeds well, and gains weight normally. Abnormal vomiting is usually more forceful, larger in volume, or accompanied by other signs. Green vomit can be a sign of a digestive blockage and requires urgent evaluation. Vomit containing blood, unusual brown colors, or continuous vomiting also needs a medical assessment. When the baby vomits, keep their head tilted to one side to prevent fluid from entering the airway. Do not shake the baby. Do not put your fingers deep into their mouth. And do not force the baby to feed again immediately. A newborn stool can change color depending on age, breast milk, or formula. In the first few days, meconium is usually black or dark green and quite sticky. Afterward, the stool of a breastfed baby. However, if the stool has bright red blood, unusual black blood, or appears with a lot of mucus accompanied by crying, parents should contact a doctor. This stool color can sometimes be related to liver or bile duct issues. If the baby has diarrhea many times with stool, that is complete. Sign number 7. Worsening jaundice. Jaundice is a common condition in newborns during the first few days of life. The skin and the white parts of the eyes may turn yellow due to increased bilirubin. Many cases of mild jaundice will be monitored by a doctor or midwife and will gradually decrease on their own. However, parents need to pay attention if the yellow color becomes deeper and spreads from the face. Jaundice appearing on the very first day after birth also needs to be evaluated by medical staff. Parents should not treat jaundice themselves by giving the baby. Improper sunbathing can also cause the baby to become dehydrated, cold, or suffer skin damage from the sun. Sign number 8. The umbilical area is red. A very small amount of blood, when the cord first falls off, can sometimes occur. However, if the skin around the navel is red, an infection of the umbilical area in a newborn can progress quickly and spread to other parts of the body. Parents should not apply leaves, oils, powders, and if the redness spreads, or the baby also has a fever, feeds poorly, or is lethargic, take the baby to a medical facility immediately. Sign number 9. A baby may cry because they are hungry, have a wet diaper, are hot, cold, gassy, sleepy, or need to. If the baby cries while stiffening their body, arching their back, having a bloated stomach, or repeatedly pulling their legs up, the baby may be in pain. Check their fingers, toes. Parents should also check clothing, zippers, or sharp objects that might be rubbing against the baby's body. Never shake a baby when they are crying. If the baby's crying cannot be soothed and is accompanied by a fever, vomiting, difficulty breathing, refusal to feed, or abnormal reactions, take the baby for a checkup. Sign number 10. Lethargy or difficulty. However, a baby should still be able to wake up for feedings, react when touched, and have short periods of alertness during the day. If the baby may open their eyes for a very short time and then quickly fall back into a deep sleep. This condition could be related to an infection, low blood sugar, or severe dehydration. Trust your intuition. If your baby seems completely different than usual, contacting a healthcare provider early is always safer than continuing to wait. Common behaviors that may not be dangerous. Many babies sneeze frequently, even without having a cold. Sneezing helps the baby clear their small nasal passages. Hiccups are also very common and usually not dangerous if the baby is still. A baby may startle, throw their arms out, and then pull them back when they hear a noise or have a sudden change in position. This is usually a natural. An infant's sleep is often not as quiet as an adult's. However, if these behaviors are accompanied by difficulty breathing, bluish skin, refusal to feed, or poor responsiveness, parents do not need to check the baby every single minute, but they should watch for a few key points, track the number of feedings, and see if the baby feeds as actively as usual. Remember the number of wet diapers, and any unusual when changing a diaper or bathing, check the umbilical area, skin folds, and the entire body. If the baby has symptoms, parents can record the start time, temperature. Do not delay going for a checkup just because you are waiting for more symptoms. In newborns, a small but clear change is sometimes enough to warrant medical. Parents need to seek emergency help if the baby stops breathing, has great difficulty breathing, or has blue lips or a blue tongue. Call 911 if the baby is unresponsive, limp, or cannot be woken up. If the baby is choking and cannot cough, cry, or breathe, parents need to perform infant first aid and call 911. Do not try to drive alone if the baby is in a critical condition. Conclusion: newborns cannot speak about how they feel, so parents need to observe changes in feeding, breathing, skin color, urination. Not every symptom means the baby has a serious illness. However, with newborns, an early checkup is usually safer than waiting too long. Parents, if this video was helpful, please like, subscribe to the channel, and turn on notifications so you do not miss safe and easy to understand newborn care knowledge. Please leave a comment below to share your experience with other families across Canada. The content in this video is for informational purposes only and is not a substitute for professional